Early warning signs of lung cancer. Lung cancer is one of the leading cancer killers in both women and men in the US and around the world. Though lung cancer can be deadly, early screening and detection can reduce lung cancer deaths by up to 20%. In this video, I will share with you some of the early signs that you should watch for to help detect lung cancer early. Indeed, lung cancer is one of the most common forms of cancer around the world. It is second only to breast cancer in women and prostate cancer in men. While it is a severe disease, advancements in medicine have made lung cancer not only treatable, but curable through available treatments or surgery. For that to happen, early detection is critical. So if you smoke, have a family history of lung cancer, or have been having respiratory issues, you should familiarize yourself with the early warning signs of lung cancer so you can seek help and catch it at the early stages. 8 early signs and symptoms of lung cancer. 1. Shortness of breath. Even early-stage lung cancer can put a strain on your respiratory system that it becomes difficult to breathe. You could notice that you are short of breath even with a little physical exertion, or it could come spontaneously, even when you are not exerting yourself. 2. Wheezing. When you are short of breath, you could also start wheezing. This happens when your lungs are inflamed, blocked, or constricted. Although wheezing could also be a sign of allergies, have it looked at if it does not go away after some time or after taking antihistamines. 3. Hoarseness of voice. If the cancer in your lungs happens to press onto specific nerves, your larynx could become affected. Typically, your voice becomes hoarse or may sound deep and raspy. Although this could occur when you get the common cold, it could be a sign of cancer if it persists for more than a couple of weeks. 4. Recurring respiratory infections. A simple cough or the common cold should not be too sinister, but if it persists for over a month, or if it repeatedly occurs over a short period, you should consider seeing a doctor. There's a chance that cancer is severely affecting your immune system. 5. Facial swelling. Lymph nodes swell when you get any kind of infection, but it could do so more intensely as a response to cancer. The lymph nodes in your face or neck might become noticeably large. This might also occur around your clavicle and chest. 6. Chest or shoulder pains. When you feel pain in your chest or shoulders not caused by a specific injury or movement, or if it seems to occur when you breathe or cough, you should see a doctor as soon as possible. It could be referred to as lung pain, i.e. pain in your lungs that are felt elsewhere due to mixed nerve signals, and could be an early warning sign of lung cancer. 7. Unexplained weight loss. Be concerned if you are suddenly losing weight too fast, especially if your activity level has not changed. Early lung cancer is often accompanied by severe appetite loss, which can lead to rapid weight loss. 8. Coughing up blood. If you experience severe and persistent respiratory issues, it could lead you to start coughing up blood. Although that could be a sign of progressing cancer, you could still catch it early enough if you seek help right away. If you experience more than one of these early warning signs of lung cancer, you should consult your pulmonologist or a pulmonary oncologist right away. Your doctor will order a series of tests that will either rule out or positively diagnose cancer of the lungs. Even if the test turns out positive, be grateful for catching it early so you have a better chance of fighting it. Following is the study reference we used to create this video. Thank you for watching. If you liked the video, please share with your friends, and please subscribe to our channel if you haven't already done so. If you want to be notified of our new uploads, do the following. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.